The other way that you can participate, especially during the Q&A, is through raising your hand. If you go to the reactions button at the bottom of your screen, you should be able to raise your hand and then just make sure that you unmute yourself. And when you're unmuted, you can start asking your question. I will do my best to keep track of anyone with hands raised to call on you so you can speak when time comes for questions and answers. And if there are any issues, please feel free to chat me in the chat box. Um, and so now we have a video that we would like to share.
There's a lot of talk these days about the pandemic. There are many voices pushing for the country to reopen, to lift restrictions on businesses and public spaces, and return to life the way it was before the pandemic. Others urge caution and warn that returning to normal too early will only worsen the devastating impact the pandemic has already had on our families, friends, and communities. With so much information coming at us from so many different directions, it can be hard to figure out what to believe. But here is the truth. The pandemic is not over. The U.S. continues
Tell me how much weight you lost with Nutrisystem.
to set record highs of new cases each day. And despite some promising trials, a vaccine is still nowhere in sight. The pandemic is not even close to over. In fact, it's only getting worse. Our communities are suffering staggering losses of life. We need to take every precaution available.
Our apologies, there's some interference because of the storm. So I think we're going to skip ahead. Um, but that video and other videos are available online with our online catalog to get more information about what's been going on with COVID-19. So to start us off in this town hall conversation, I would like to invite Dr. Harp to speak to everyone a little bit. Like we were saying before, and as was mentioned in the video, there's a lot going on with COVID. It seems like things are constantly changing. Um, so, Dr. Harp, would you be able to kind of talk to everyone about some of the basics of COVID safety and things like hand washing, mask wearing? I know that people have probably heard it a lot, but what are some basics that you think everyone really needs to know and be aware of as we're moving through this pandemic?
Okay, so thank you, and I'm really happy that you all are doing this. So things that you've heard before, I'm sure, but I just want to iterate the importance of washing your hands. And so I know that it sounds really simple, but we touch our face a lot, probably a lot more than we notice. And so there are, a number of times when you need to wash your hands. So you need to wash your hands before and after the following, like touching any part of your face. So whether that be your eyes, your nose, or your mouth. And just on a personal note, I used to wear contacts actually, maybe a year ago was the last time I wore them because I just don't want to put my fingers in my eyes. So you know, so vanity kind of has to go out the window. The most important thing is keeping yourself safe. Um, you want to make sure that you wash your hands before you touch your mask and after you remove your mask. Whenever you're entering and or leaving a public space, you should wash your hands. Also, when touching anything that other people frequently touch, so whether that's doorknobs or, you know, like when you're out in public and you're touching the cash register, or, you know, when you're putting your card in like an ATM, making sure that you do that as well. And I know that it's going to sound simple, but you know, washing your hands, we probably never really thought about how we do it, but you want to make sure that you are running, you know, clean water. It can be warm or cold, that part doesn't matter. You're going to wet your hands thoroughly beneath the water. You're going to lather your hands, and then you want to make sure um, that you lather the front and the back, and then that you go in between your fingers, and then also get beneath your nails, and you're going to lather and rub for 20 seconds, and then you're going to rinse your hands with clean water. You can also use a hand sanitizer, which is not as good as using soap and water. If you're going to use a hand sanitizer, then make sure you read the label, and it should tell you if what the percent alcohol content is in it. If it's over 60%, then you can use it. But you want to look and see how much of the hand sanitizer you should use, because you really should, your hand, you should put it in the palm of one hand, and then you use it very much like how you use the soap and water, except obviously you're not using water. So your hand should be wet front and back, and then by the time it dries, you know, with you rubbing it together front and back, it should take about 20 seconds as well. As far as masks, this has to be one of the most frustrating things as a provider. You know, taking care of patients, because you know, a lot of people wear their masks the wrong way. So it's kind of like they're wearing them like a fashion statement or something, and they're wearing them beneath their chin, which obviously that's not going to protect anybody. So you know, you need to wear the mask. It needs to fit very well. It needs to fit over the bridge of your nose. So I tell people, you wash your hands first, put the mask on behind your ears, or if it ties in the back, you want to pinch your nose so that it's tightly fitted around the nose, and then around the sides. Um, and when you're taking off the mask, of course, wash your hands again. If it's a loop behind the ear, you don't want to touch here. You want to touch the loops behind the ear, and then you want to pull it off. Um, there are different types of masks that people can wear. There are the cloth masks, which are fine. There are the surgical masks, which are also fine. The N95 masks, those should be reserved for healthcare workers, you know, because there is a, you know, we don't have enough N95s for a lot of the frontline healthcare workers. So, you know, in an effort to save them for the frontline workers so that we can help save people's lives, we should, you know, leave them for the healthcare workers. But if you happen to have them, then make sure that it fits well. The reason why it needs to fit well and snugly around your face is because if there's any openings on either sides, then obviously then the particles can get through. So it can get through as you're talking, and which means that it can infect other people, and you as well can be infected. Anyone that's 2 years old or older can wear a mask. If anyone has any difficulty breathing, then you would not wear a mask. So if someone in general has problems breathing, then they shouldn't wear a mask. And then children younger than 2 years old shouldn't wear a mask either, because they wouldn't be able to let you know if they're having any difficulty with breathing. Um,
So
and
in regards Oh, I'm sorry. In
mm,
regards to masks, we have a quick question about thoughts on the KN95 masks, and
and
also the idea of wearing two masks, because that's been something coming up in the news. If you could
yes,
touch on that, that'd be wonderful.
yes. So you should wear two masks. You can wear a surgical mask beneath your cloth mask. And so there is a recommendation that people wear two masks now. And then as of February 2nd, which is tomorrow, there is a mask mandate, meaning that on all public transportation, whether that is airplanes, buses, trains, things of that nature, everyone has to wear a mask. That is now a federal law. It's surprising that that wasn't the law before, but it now is. Um, and then I also want to say for children, it needs to be a mask that fits the child. And I don't know if I answered the KN95 question, but yes, KN95s are okay, are good. Um, the 95 part of it means that it filters out 95% of, or protects you against 95% of the time from virus particles entering. Um, are there any other questions about mass?
It looks as though Al Lucas has a question. Go ahead. You can unmute and ask. There's a hand.
Well, if the N95s are better, the government could insist that enough be produced for everybody. That's what the National, I don't know, Defense Procurement Act or whatever, something like that is called.
Right. I would love for the N95s to be available for everyone. I think what a lot of people are doing is they're ordering the KN95 mask. That's what we do, even though even though I'm a physician, but my family, they order the KN95 mask. But we still double mask. We still will do that. And then really, in terms of safety, um, the last time I ate out in public was March of 2020. And the reason is, it's not necessary. You don't have to go out in public and in public situations and eat. You can, but there, of course, is a risk. If you're going to do it, then you need to remain 6 feet away from the other person. So masks do not take away social distancing. So if you're gonna wear a mask, you still need to socially distance. The other thing is if you have been in close contact with someone who has COVID-19, um, then of course there is a risk that you could get it too. And close contact means 15 minutes with that person, and 15 minutes within 24 hours. So not 15 minutes at a time, 15 minutes in an entire 24-hour period. So hopefully that is helpful.
So please talk about the protective medicines. In Egypt, they gave ivermectin to family members of people who had COVID, and it greatly reduced the number of family members who picked up COVID.
So, at this point, I don't know if Dr. Jones is speaking about the medications later.
We
I wasn't,
can,
but I can say that it's not recommended yet. I've seen that what I think it's just one report and it hasn't been peer reviewed, and I'm not sure that it is a durable recommendation right now.
So it has been, the peer review came out recently, but peer review, no, we have 3,000 people dying a day. Please do not stand on ceremony as to what the NIH is willing to okay.
And may I respond to that? It's not ceremony. There's some things that have been highly hyped that later, when it was put on through peer review and through proper studies, was shown not only to be not helpful, but actually harmful. And so I would say that people should, protect yourself through the public health interventions that are being mentioned. But if it's something that has not been shown to be effective in multiple studies, then I wouldn't just jump on it because you might be harming yourself.
exactly. Thank you, Dr. Jones. I think it's very important to make sure that, we're staying safe, not just with what we do, but, what we're following. That's a wonderful point. We don't want to get too excited about something that's not, shown to work and then end up putting ourselves or other people in more danger. So we are nearing, we're going to keep moving the conversation along. Um, because I know there's a few more topics that Dr. Harp wanted to touch on before we move over to Dr. Jones's portion of the presentation. So Dr. Harp, if you would like to keep talking about quarantining, self-isolation, home and work safety, or signs and symptoms of COVID, um, go right ahead. We have a couple more minutes and then we'll continue on through the conversation.
Okay. So quarantining is going to depend on what your local public health department is mandating. But generally speaking, when you would quarantine is when you've been in close contact with someone who has COVID-19. Um, Another thing that I want to mention is the importance of, in terms of at-home safety, is staying within your bubble. And so what I mean by that is, like an example would be, I love my family very dearly, just like I'm sure everybody here does, and very close to my brother, but he lives in a different house. And my little nephew lives in a different house, and you know. And so they don't come to our home and we do not go to their home because we need to protect one another. If there was any time that for some reason we needed to come together, then we would wear masks. But we don't do it. We didn't do it for the holidays. And so so making sure if even if it's a family member, if they don't live in your home, then you need to make sure that you wear a mask when you're in the house together, or in any smaller space together if you're not outside. So close contact, in terms of if someone else has COVID-19, is if you were in physical contact with someone, if you hugged them, if you gave them a kiss, if you shared eating or drinking utensils, if someone sneezed, coughed, or sang near you, then anything that can cause their respiratory droplets to get on you, and they're COVID positive, then you would quarantine for 14 days. And that means staying at home. If there are any other people at home near you, then you can, quarantine away from them. And so that is for 14 days. The CDC still stands by the 14 days. And then you're going to watch for any symptoms of COVID, like fever, chills, shortness of breath, sore throat. Um, and the other option is what Connecticut does is, 5 days from that contact with the person who's COVID positive, you could then 5 days later get a COVID test. After that COVID test returns negative, you would still quarantine, and you would quarantine for 7 days. The other option is to quarantine for 10 days after exposure without testing. So hopefully that helps clear things up. There can be additional symptoms of COVID. So, the main issue and the reason why people need to wear masks is because a lot of people can be asymptomatic, or they can be asymptomatic, meaning that they don't have any symptoms of COVID. And so that means that they can carry the virus and spread it to other people without knowing that they're doing it. And the other people can be pre-symptomatic, meaning that they're not showing symptoms yet, but in a few days they will. And so because they don't know that they have the virus and are spreading it, at least 50% of transmissions occur this way, by people that carry the virus, don't know they have it, or people that have not yet shown symptoms. So that's why it's so important to make sure that you're washing your hands and that you're wearing a mask.
Exactly. Thank you so much. That also, I think, offers a perfect segue, because as we know, and as a lot of people, I'm sure have heard, it's when you're asymptomatic, it can be very dangerous because, you don't know that you're carrying COVID, or that you have COVID. And that could put people who around you at risk, especially people who are high risk. So that leads me into my next question, for Dr. Jones. What is high risk? Like, what does that mean? I feel like that's a term that's getting thrown around a lot. Um, and so, can you kind of talk about what's high risk? Who is high risk? What does that mean?
Okay, we all are at risk. That's the first thing, because it's a new virus. Nobody's been exposed to it before. And actually, even now, only about 17% of people in the US are known to have been infected. And only about 2% are already vaccinated. So that means that 80% of the US population is at risk. But there's also, that's one thing, we're all at risk. People who are essential workers are more at risk, because when we told everybody stay home if you can, essential workers can't stay home. And there actually is information in the MMWR, which is something that's put out by CDC on excess mortality during the pandemic by occupation. And the occupations, which were at higher risk of excess mortality, included food and agriculture workers, transportation and logistics workers, facilities workers, and manufacturing workers. Well, we heard about that. We heard that people in meatpacking plants were at higher risk. Okay. We also heard that people in prisons were at higher risk. So there are a lot of people who are at higher risk of getting infected. And the things that determine it are, are you able to wear a mask? Are you able to safely distance? Are you in indoor places with people that you don't live with? All those sorts of things that were already mentioned can make you at higher risk. The second thing is risk of severe COVID. And so we know that a lot of people are actually getting COVID, and certainly in Cincinnati, where I'm from, the highest rate of cases of COVID is actually in people between the ages of 20 and 39. That's the greatest number of people are getting COVID from there. But the greatest risk of hospitalization and death is actually in people who are older, people who are living in what we call congregate care facilities, or where like long-term care nursing facilities, assisted living, group homes, and people who have various types of chronic disease. The Centers for Disease Control actually have a list of the types of health conditions that are known and proven to put you at higher risk for severe COVID, which is hospitalization, admission to the ICU, mechanical ventilation, or death. And those include, and I'm just going to read it off, people who have cancer, chronic kidney disease, chronic obstructive lung disease, Down syndrome, various heart conditions such as heart failure, coronary artery disease, heart attacks, or cardiomyopathies, immunocompromised, people have things that may make you immunocompromised, obesity, and severe obesity are actually associated with higher risk of severe COVID. Pregnancy, women who are pregnant are more at risk of severe complications if they become infected. And that's something that's a little bit problematic. And I think we can talk about that later, because the vaccines that were tested did not specifically go out to test pregnant women, although some people who were in the vaccine trials became pregnant and did okay. Sickle cell disease, people who are smokers, people who have type 2 diabetes. Now, other people may be at high risk, but the data is not as clear. And so that website, basically has a running tab of information about chronic conditions that can make you at higher risk. So that's sort of the first thing: who is at higher risk for infection, who's at higher risk for death. So now, in terms of COVID deaths, we know that a total right now in the US of 24 million cases of COVID have been diagnosed, and 441,000 COVID deaths have been identified. We know the whole question about the excess deaths is that some people may die. They may die because they were helped along by COVID, but they don't have COVID on their death certificate. So people are finding that there are a lot of excess deaths associated during this pandemic compared to the average of a couple years prior to last year. But we know that there are 441,000 deaths. That's a huge number. That's more than what we lose in the wars. It's just really a huge number. Another question that we were asked was that I was asked to talk about, we've talked about it already. What does it mean to be asymptomatic? You just don't feel sick. You're asymptomatic because you don't feel sick. You don't realize you have it, but you could give it to other people, especially older people and people with some of the chronic conditions that I've mentioned. I was asked to talk about whether the vaccine was rushed. And that's really part of the whole vaccine hesitancy question, is that people are like, I'm just really not quite sure. I think I'm gonna wait a little bit and see what how things go. But actually, there are many stages of the vaccine process, and these stages have not been rushed. People were working on, for the 2 vaccines that are currently available, the mRNA vaccines, people were working on that prior to the pandemic coming up. People were working on coronaviruses of various types prior to this coronavirus coming up. And then they were able to sort of pivot and use what they've already been doing to try to develop the vaccine for the coronavirus. Now, the mRNA vaccines are a way of presenting information to your body to tell your body, look, if you see this, hit it, okay? And so I'm gonna give you 2 examples of how the vaccine may be working in, just in an analogy. One analogy is, okay, it's sort of like a wanted dead or alive poster, okay? So the vaccine is saying, this is a little bit of what this virus looks like. It's just the spike protein. It's not the full virus. It doesn't have any viral particles in it. But this is a little bit of what it looks like on the outside. If you see it, body, hit it, kill it, okay? And so basically it's trying to train your body to on site go, oh, that's the wrong thing, kill it. Another example for what vaccines may do is, and I'm going to use this for, can you get COVID or transmit it after you have the vaccine? Consider a vaccine is sort of like a suit, a space suit. And so you're walking through a room and somebody has a glitter bomb, and that bomb explodes and it's just all over everywhere. If you have that spacesuit on, you're not going to get that virus in your lungs. But if you still have that glitter stuff on the outside of that spacesuit and you pass somebody else, you may shake some off and they might get it in their lungs. And so basically the vaccine is something that's telling your body to hit something if you see it, and it's protecting you from getting ill if you're exposed to the virus, but it's not necessarily protecting other people, even if you were vaccinated, okay? That's why when we say when you get vaccinated, you still have to do all the other public health things that you're being told to do to protect other people, because the vaccines were not developed to keep you from getting the full infection. They were developed to keep you from getting symptomatic and hospitalized and to keep you from dying. So the stages in development of a vaccine, you have the exploratory stage, the preclinical stage, those things were already going on. Then you have what's called the clinical development stage, phases 1, 2, and 3. So phase 1 is where you're actually testing for toxicity. You have a few people, you test for toxicity, you test for what types of doses you can give. That's phase 1. Phase 2, you may have a couple hundred people, and then you're testing for common side effects and to see if it actually stimulates an immune response. Phase 3 is when you say, okay, does it work? You're testing for efficacy and for safety. And both the vaccines that are available now were tested in a large number of people. Previous vaccine development studies, they didn't have that much money, and the company didn't really know if they were going to be able to do it or not. And so you sort of limped along, you enrolled people a little bit at a time, tried to just build up your case. But in this pandemic, we had a lot of money put into developing vaccines quickly because of the fact that it's so dangerous. And so there was money put up even to start the manufacturing process before the vaccines even were finished with their phase 3. So that cuts time. You also, instead of having 5,000 or 6,000 people in a vaccine study, for the Moderna study, you had 30,000 people. For the Pfizer study, you had 44,000 people. And so when folks are saying, I'm gonna wait, I'm gonna wait and just sort of see what happens with the vaccine until more people have taken it, a whole lot of people have taken these vaccines, and it has a very strong safety and effectiveness profile for both of those vaccines. Since the vaccines have been rolled out, another million, a couple million doses have been given. And so, and we still have that safety profile. People are concerned about the vaccine. If I take it, am I at risk of an adverse reaction? And the adverse reaction profiles, the serious ones are very low. And the most serious one is the one that we call anaphylaxis. That's where you have a sudden acute allergic reaction. Your throat may be closing up. You may find it hard to breathe. Your blood pressure drops. That has happened in only 2 to 3 people per million. So yes, it can happen, but it's probably not going to happen to you. Okay. And then even those people who had it, nobody died. They did it in a place, they got epinephrine shot. They didn't die. Okay. And so the safety profile is actually very good for both of these vaccines for severe reactions. You will have a little bit of a sore arm. You may have a fever. You may have a headache. You may have some chills. Not going to die. But if you get exposed to COVID, you have a risk, at least a 1 to 2% risk of dying from the COVID. And then even if you get COVID and you recover, about 30% of people who have had COVID and recover have what they call long COVID. And that's where you have continued COVID symptoms over months. We also find that people who've had COVID and recover, their lungs still have some damage if you look at it. And so they have decreased exercise capacity. There's a lot of things that we don't know about COVID, but what we do know is that it's affecting multiple organ systems, and it can affect some people for a long period of time. And when you look at young people, because I told you, at least in Cincinnati, the highest age group that's getting COVID is young people, essential workers, people who are out. We don't know what the effects of the long-term chronic effects of these insults early on will be for these people. And so if you can avoid getting it at all, you really want to try to avoid getting it. And
We have some great questions in the chat. So somebody asks, what do I do if I have an underlying condition that makes it harder to breathe, like asthma or chronic obstructive pulmonary disease? What steps should I take? And I think that also kind of goes along well with another question. Someone asked, are there diseases or disorders that would prevent someone from receiving the vaccine, or basically that it would be advised for them to wait?
The ones that you would advise people not to take the vaccine for are if you've shown an allergic reaction to the ingredients of the vaccine. In both vaccine trials, they tried very hard to enroll people with chronic medical conditions, to enroll people across the age range, to enroll people from people of color. They had 10% African Americans and almost 20% Latinx people in each of these trials. And so they tried to make sure that they had enough people in these trials to be able to answer the question, should I personally take it, for many people. But if you have a history of a serious reaction, that's the one where you would want to talk to your doctor and sort of weigh it. When I said 2 to 3 per million had anaphylaxis for the Moderna trial, those people, at least 50% of them had already had a severe anaphylactic reaction to something else before. Well, you know that you're going to be careful with those people, and most of them had allergies to something. We know about 30% of the US population has some sort of allergy. And so you're going to be a little bit more careful. If you want to take it, which I advise, you may want to take it in a place that's not quite so community oriented, maybe in a clinic or in a hospital, where if you get into trouble, you have people there who can sort of help you with it.
And then we have another really great question that I think touches on a lot of concern around the vaccine and having had COVID or not having had COVID. Someone said, I've had the virus and I had antibodies, but I heard that antibodies go away after a while. So if the vaccine is meant to help with antibodies, how exactly does that work with the vaccine, and will the antibodies last?
It is recommended that even if you've had COVID, that you go ahead and get the vaccine, because the natural response to the COVID may decrease over time, but it's looking like the vaccine response to the kill it, want it picture, thing is lasting and it's higher and it seems to be durable. And so, a lot of people, if you had COVID and you just, toughed it out at home, your antibody levels may be up for the first month or two and may dwindle down. So the CDC is recommending that even people who have had COVID before get the vaccination.
Right. So also, very similar to like when people get the flu vaccine. And so even if you've had the flu before, then you still get the flu vaccine. And I also just wanted to remind everybody to get their flu vaccines this year also, so that we don't have to try to figure out if someone has a flu or if they have COVID. Another question that some people might ask is, can women that are pregnant or breastfeeding get the COVID vaccine? And this is something that, we want people to discuss with their obstetricians, their pregnancy doctors. And there's no, because it wasn't studied in pregnant women or women that were lactating, there's nothing that says that you cannot get it. There's no known issue that's happened to women that were discovered to later be pregnant. And for people that are lactating, there's no known issue. So I have a 9.5-month-old. And one of the reasons why I got the COVID vaccine was, to make sure that I'm protected so I could see her grow up. Because, we're, it's one of those things where, it's a challenge, it's a challenge for a lot of people of color, because, we've seen the things that, essentially experiments on with the Tuskegee experiment on African American people. So there's a lot of mistrust. And so I just wanted to mention that to say, one of the developers of the vaccine was African American. A lot, and it's important that we, that we are protected and that we protect ourselves and make sure that we, when it becomes available for everyone, that you consider getting the vaccine to protect yourself and your family.
And I wanted to add on to that with the question about the Tuskegee study. With the Tuskegee study, we're upset because when an effective treatment came out for syphilis, it was not offered to the men. It's not that they were in the study, it was that there was something effective and they didn't get it. And so what I really want is for all of our people not to stop getting it by talking about Tuskegee, because we have an effective, safe vaccine. Go get it. Don't hold your own self back, and then wish that you had taken it if you developed COVID. I wanted to just add one other thing, which was the question that came out about vitamin D, because there is information that people, when you look at people who are hospitalized, a lot of them have low vitamin D levels. I haven't looked at this broken down by Black or white, because a lot of Black people naturally have low vitamin D levels, possibly partly because they're not drinking a lot of milk because they have lactose intolerance, many of them. But if you were going to try to do something to help yourself, then at least taking some multiple vitamins that have some vitamin D in it might be useful if you're just looking for something else that can help boost your chances of not getting it.
Thank you so much for touching. Oh, go ahead, Dr. Harp.
I'm sorry. I was asked about work safety, and I just wanted to kind of let people know what I do at work.
Go right ahead.
Thank you. So I double mask. So I double mask at work, and I also wear, because, glasses don't protect you here. And if someone were to cough, then it could get into your, what are called the mucous membranes. So I wear either goggles so that I'm covered on the sides, or I wear a shield in front of my other mask to try to protect any droplets from getting into my eyes. So I just wanted to make sure that I mentioned that. And then of course, frequent hand washing.
Can I respond to one of the questions that's in the chat? Is two of them real quick. COVID is just it stands for coronavirus, that's the CO, and the VI is the virus disease. So COVID is just coronavirus disease shortened. The COVID-19 is the SARS-CoV-2 coronavirus. So the SARS-CoV-2 coronavirus causes the COVID disease.
Thank you. I think that does, I saw two questions about that and I was actually about to ask those. So thank you for jumping in to answer that. I appreciate it. Um, and so kind of on that note, actually, we've been hearing a lot in the news about this new variant of COVID that's been popping up. Would you both kind of be able to talk a little bit about that? Like, what is that? What does it mean, especially in light of the vaccine? If you could just kind of talk a little bit about that, I'll let you
Um,
guys split the, sorry, go ahead.
Have you all ever played Pass It Down, which is a party game where you whisper something in somebody's ear and then they whisper it to the next person, they whisper it to the next person, and by the time it comes back, it's completely changed? That's what's happening with the coronavirus. Basically, the virus is going through a lot of different people, and each time it goes through a different person and starts replicating, there's a possibility of having a mutation or something changed. And so eventually you're going to get something that's different enough from the first virus that was circulating in the community that is what they would call a variant. And the variant can do things, it may do nothing, or it may make the virus more infectious. It may be able to infect people more, or it may make the virus look less like what you present it to the body with your vaccine. So it's like if you had a wanted picture and the person was sitting there with the mustache and the beard, and then it shaved its head. Okay, so you might not recognize it then. That's sort of what the concern about the variants is.
Yeah, I think I don't think I can do a better job explaining it than that. Yeah, so that's why it's important that that we reduce the transmission of the virus to help try to prevent it from, we want to stop it from replicating. So making more copies of itself, and then in doing that, then it should help stop the changes, the alterations that happen. And so, and I didn't mention the statistics, but if you wear a mask, it can reduce the risk of transmission by about 70%. So, it could just be that easy as we just protect ourselves and one another. I did want to answer the question somebody asked, if wearing a mask causes carbon dioxide buildup. And the answer is no, because carbon dioxide is very, very tiny. And it can, so when you're breathing out, you breathe out carbon dioxide, and it goes through the mask. So you don't have to worry about it building up.
All right. So we have a lot of great questions in the chat that I would love to kind of move into. If there's nothing else that you have that you would like to share with everyone, Dr. Harp, Dr. Jones, was there anything else you'd like to touch on before we go into Q&A?
I just want to touch on one thing that was in the chat. Question about it says Moderna vaccine was given to 30,000, but only 400 were exposed to virus. No, everybody is potentially exposed to the virus. The trial was not exposing anybody. The exposure was the community spread of the virus. And so everybody in the vaccine study and also everybody in the community had a chance to be exposed to the virus. But what we saw was that the people who received the active vaccine did not get symptomatic COVID disease.
Wonderful. Thank you so much for addressing that. I think it's really important to hear, the information that you're sharing, because I think sometimes it can get very difficult to understand the information that's coming out at us when so much of it is coming out all of the time. So thank you for sharing that with us and kind of breaking that down. So we're going to move into Q&A. So everyone who's been putting questions in the chat, thank you so much. Feel free to continue doing that. And I'm going to move through some of the ones that we've been getting so far. and we'll kind of just bounce back and forth. So Dr. Jones, Dr. Harp, feel free, whoever wants to answer. Um, so one question that someone asked is, should people be wearing gloves? And does spraying chlorine and or alcohol on my hands kill the virus? So Dr. Harp, would you like to respond to that one?
Sure. No, you do not need to wear gloves, and the reason why is because it can give you a false sense of security. And then you may end up touching your face, not realizing that you've done it, and then of course your gloves have could be infected. So I would say no to that. I understand the desire because that's I did the same thing, when about a year ago, but um, you know, y- y- and you cannot reuse gloves. So in the medical setting, yes, I use gloves, but I don't use them all day, and I wash my hands, and so that's the main way that to reduce transmission is by making sure that you do a good job washing hands. Now I also don't touch doorknobs, so and I didn't do that before COVID either. But I mean, if you are using the bathroom, once you wash your hands, to turn on the faucet, if it's a public setting, I normally use paper towel, throw it away to open the doorknob. I normally use a clean paper towel. So just that type of thing, making sure that you do that, but you don't need to wear gloves.
In any sort of high touch area, like if you're going through the self-serve at the grocery store, after you finish, you're going to wash your hands or at least use sanitizer. If you pump the gas, you get in the car, you use your sanitizer right away, because you know that you may have been exposed, but the false security that Dr. Harp is talking about is real. And if you look at how many times you touch your face anyway, knowing that it's a problem, people generally do it like 30 to 40 times an hour.
So on a similar note, when we're thinking about protective equipment, and things that people should be using, um, so someone had a question. Let's see. So people were asking, can the virus spread through pets? And also, can I get sick from wearing my mask for too long? So would you be able to speak to those two questions?
Yeah, we don't know for the pets. And Dr. Harp, if you want to talk about the mask wearing.
So as far as the mask is concerned, one I know it's confusing because most masks are meant to be disposable. So meaning that you wear it one time, you throw it out. As far as like the surgical masks are concerned, because there's been a shortage, people have been using their masks a little bit longer. Um, Same thing for the N95 mask, back when there wasn't an issue with the quantity of N95 masks, we used to throw out the N95 after each use. Now with the N95, what we do, or with the KN95, what you can do is after you've worn it, as long as it's not soiled, meaning that not soiled with, either it being wet from your breathing into it, or wet from other things, then you can take it off without touching the front of it. You take it off. If it's a KN95 or N95, you put it in a paper bag, and then you put the part that has not been towards your face down on the surface, and meaning inside the paper bag. If it's a cloth mask and you've worn it, then you can wash it, of course. So that's the benefit of wearing a cloth mask, is that you can wash it in the washing machine, dry it in the dryer. And then if you're using like the surgical mask that you punch at the top, you can, because you get about 50 to 100 of those, you know, you can, you can dispose of those every day.
And so when it comes to reusing or not reusing, cleaning masks, etc., someone asked about sanitizing masks. I think they asked, can you sanitize a mask using like a phone sanitizer or a UV sanitizing device to make it last longer?
So they have mentioned UV sanitizers for masks before. I don't know what type of mask that would be, but you know, I haven't done enough research on that. Like I said, for a cloth mask, you can wash that. And then if you're going to wear a mask beneath it, I would just get the disposable mask and wear the disposable mask underneath, and then dispose of it each day.
And I would add, if you're trying to do this and you are a healthcare worker, you might not want to even try that. I mean, in terms of doing this thing at home, because there were a lot of studies trying to look at how you could safely sanitize the N95 masks. And I don't think that the ultraviolet was very effective for that.
Wonderful. Thank you. So I'm going through the questions that we still have. I promise everyone I'm trying to get through all of them because we had some wonderful questions in the chat. One question that came up, and this is kind of around vaccines, because I think there are, with things being newer with the vaccine, the information that people are receiving, I think there's definitely a lot of questions around that. So someone asked, what about the J&J vaccine? Is it less efficacious than Moderna or Pfizer? And someone else said there's a conspiracy theory that says Blacks are being tagged with the vaccine. Could you please speak to this? So I think it's really important to help, kind of dispel some of these worries and fears, and also to be very informed and aware about the different vaccines that are out there and their efficacy. So if you both could speak to those two things, and there's definitely more vaccine questions, and I will do my best to get through all of them. But if we could start off with those two, that would be wonderful.
The J&J vaccine is not out yet, but they have just put out information, and the 94 to 95% efficacy of the Moderna and the Pfizer was just way out of the park. But when people were talking about, we really wish we could have a vaccine, people would have been happy with 50%. Okay, which is what you can sometimes get with the flu vaccines that come out every year. The J&J vaccine is, I think it was something like 67% effective in decreasing moderate to severe COVID, but 85% effective in decreasing severe COVID. So that's great. The advantage of the J&J vaccine is a single shot, and it doesn't have the very rigorous cold chain, what we call cold chain requirements that the two other vaccines have. So it's actually more durable. And so basically, the vaccine you want is a vaccine you can get, because there's a shortage. And if you can get any of them, line up and get it.
Yes, I don't have anything else to add. I think that was a great response.
Thank you. Let's see.
Oh, and no, that they're not tagging people with that. I mean, I my concern, and I work for a community health center. So, so the great thing about that is that we serve the underserved. My issue with how the vaccine is being rolled out is that, we're still on 75 and older, which, which harms people of color, because we don't have a lot of people that are 75 and older in our population, or a lot of the people in our populations are younger than that. And so if we, my point is that we want people to be vaccinated. We want people to be vaccinated because we know that COVID is claiming the lives of people in general, and especially people of color. And there's already racial disparities and issues in healthcare to begin with. And then you add on that, not getting the vaccine, and that just makes things worse. So I would implore people to, to kind of let go of the myths and the, and to, you have to do your research, you have to feel comfortable. But but the COVID vaccine is something that is necessary. I mean, you have a known risk and something that's killing people, and then you have a vaccine that is, has a 95% chance of, keeping you healthy and, or at least well enough to survive through the pandemic. So, I'd implore you to consider getting the vaccine.
Thank you. That was very well put. Um, so we had another question relating to false positive test results. So someone said that a friend of theirs received a false positive test result using a rapid test. And is there anything to note about testing efficacy? And in a similar vein, I believe someone asked about, I'm looking for the specific question, but I think someone asked about the different types of testing because there's the nasal swabs, there's also some of the at home testing kits. Um, Yes. So someone asked, could you speak about at-home tests and the differences when they should or shouldn't be used? So between sort of, I guess that whole question is around the efficacy of test results, false positives. I think there's some question around that, and I can repeat that question if need be. But if you guys could respond to that, that would be wonderful.
The benefit of at-home testing is that you have more access to the test. One of the problems that we've had with the US in general is that we haven't been testing much. We haven't been putting the testing locations in vulnerable populations. We've been putting it in the rim around where a lot of majority people live. People haven't been able to get the results timely. And so, if you have a home test kit, then you can test yourself whenever you feel like it, if you feel like you may be at risk. If you're the sort of person who just will not go and get tested because you don't want the government telling you that you must then quarantine or isolate, but you get that answer and you realize, okay, really, I should stay back. Maybe I shouldn't go to this party. Maybe I shouldn't go see my grandma, that sort of thing. There's benefits from having that type of testing. But I'm not familiar with the nitty gritty of the sensitivity and specificity of the antigen tests.
Yeah, I cannot give you the specifics. I believe that it is 70% sensitive, meaning 70% of the time it will detect if the result is positive, it will detect it. But there was just the COVID task force for President Biden was on today, which I think is wonderful that they're so transparent. And now there's a company that has come up with home tests that are 95% sensitive. So, meaning that they'll, the correct result will occur 95% of the time. And those have not been rolled out yet, but they did give $230 million, I believe, to the company. And then, only 100,000 of those tests will be given. And then, the $230 million was to help them roll out and increase production of the additional tests. So the hope is that those will be available soon. My issue with testing is if you have symptoms, then I think you should just, think to yourself, this might be COVID, and then you need to protect yourself and your family, meaning isolate away from them. Even if that means in a certain part of your home. The issue that I have sometimes in going to testing centers, and I'm just speaking personally, what if I get there? The other people that are there obviously think they're sick, right? And so then you're walking into a place where people have COVID symptoms and are being tested, so so, to err on the side of caution, if you really think you're sick, you don't necessarily have to have the test. You can just go ahead and quarantine. The good thing about having the test, though, is knowing what the community spread is. And that's extraordinarily helpful. And then also contact tracing is helpful, because then we can figure out who else is at risk of being positive, because they were around you. And so that's helpful for a number of reasons. It can help us, let people know. It can help people get treatment earlier, before their symptoms get worse. So there's a lot of benefit to being tested. And then there are some testing sites where you can just stay in your car and then be tested there. So a lot of like CVS, for example, does that.
I really like outdoor testing sites.
Wonderful. So we are already a little bit over time. So I have kind of one more question, and then I know a lot of great questions were asked in the chat box. So anyone whose question was not responded to during the town hall, please do not worry. We are going to do our best to make sure that everyone's questions get answered and that the information is out there and available to you all. So please don't be upset if your question did not get directly answered in this moment, because it will be eventually. And so the final thing that came up a couple of times within the chat box, this will be our last question before we wrap up, is people are talking about once you get the vaccine, or if they've already gotten the vaccine, they will have 95% immunity after 2 weeks, they said. But what about immunity to the new variants? Would you be able to briefly speak on that before we wrap up the town hall for the rest of the evening?
People have been studying that, and theoretically, it's possible that the new variant can sort of escape the antibodies that are produced by these vaccines, but it has not been shown. The Moderna vaccine just came out, and folks just came out and said the level of coverage is a little bit less than for the first type of the coronavirus, but it still is considered to be enough to neutralize it. And so right now it looks like it's okay, but they are actually going to be developing a booster shot based on the variants, sort of like in the future. Can I just say real quick a couple other things? Okay, so one was a question. If you have cancer, should you take the vaccine? Yes, you should. Talk to your doctor, but yes, you should. Because people with cancer may be at increased risk of severe symptoms. If you ask how long does it take before you get COVID, there is no magic number. It's a function of time of exposure and severe, the dose of exposure. So somebody could just come cough in your face, and if they were excreting a lot of the COVID virus, you could get it just in a second. Okay. And then the last one, can you get COVID again? Yes, it's rare so far. The question is, can you get COVID again if you had the old COVID and then come up with a new variant? Some people are saying that is possible with some of them. It still is sort of in the air. It's just a question.
Yeah, and then there's a question, if I had coronavirus, do I still need to wear a mask? Yes, to protect yourself and other people, please. If you're outside and no one else is around, you need to wear a mask. No. I go walking, and I carry the mask with me just in case there's someone that is gonna walk their dog or something. I make sure I have a mask that I can quickly put on, just in case. So I would always carry one with you.
One last comment. Herd immunity. Basically, herd immunity, there's only two ways that you can get the antibody to protect yourself against the virus. One is vaccination. The other is you actually get sick, run the risk of dying, run the risk of long COVID. And if you happen to make it out, you will have antibody levels high for at least a little bit of time. Herd immunity is basically you get enough people vaccinated so that the virus can't jump from person to person to the person, because they'll jump to this person, oops, they've already been vaccinated. This person, oops, they've already been vaccinated, and it can die out. And so the people who can't get vaccinated still have protection because they're surrounded by a lot of people who have been vaccinated.
Right, and we don't want to get herd immunity by people getting COVID, because almost 10% of our population would die if that were if that were the case, if we tried to do it that way, which is what the other president was interested in herd immunity, and that's extremely dangerous. So we want people to be vaccinated. We want people to protect themselves, wash their hands, wear masks, and when the vaccine's available, get the vaccine. I mean, when you're in the group for the vaccine, to get the vaccine.
Yes. Well, thank you so much, everyone, for attending tonight's town hall. And thank you so much, Dr. Jones and Dr. Harp, for spending time with us this evening. You were both wonderful. I found this very informative, and I hope that you all did as well. So on behalf of Crystal Emery and the URU team, we hope that this was a helpful evening for everyone, and that you'll join us again on Tuesday, February 9th in Spanish, and or on Monday, February 15th in English, to discuss more topics with other professionals about what's going on with COVID, things that you should know. And there will be flyers out with more specific information. The phone number, the link, all of the Zoom information will remain the same. So if you're not sure what's going on, but you want to check in, just use that same link on the flyer that you used to join tonight. So we are humbled to be able to be with you tonight to serve our community. And we just as a group would like to say namaskar. Namaskar, Dr. Harp. Namaskar, Dr. Jones. Namaskar to all of you. And thank you so much. And we hope to see you again soon. Have a great evening, everyone.
Thank you.